Although the risk of getting infected when giving first aid care is very low, providing this care can put you in close contact with another person's body fluids, which may contain pathogens. Hand washing and using personal protective equipment, PPE, are two main steps you can take to limit your exposure to pathogens. Hand washing is the best approach to lowering the risk for infection. As time allows, wash your hands before giving care and always wash your hands after giving care. Wash your hands using soap and warm water for at least 20 seconds. If soap and water are not available, you can use an alcohol-based hand sanitizer. Dispense the recommended amount of product into the palm of one hand. Rub your hands together to cover all surfaces, including underneath the nails and between the fingers. Continue rubbing your hands together until the product evaporates, which will take about 30 seconds. Although alcohol-based hand sanitizers reduce the number of pathogens on your hands, they don't eliminate all types of pathogens. So as soon as hand washing facilities are available, wash your hands with soap and water. Personal protective equipment, or PPE, such as latex-free disposable gloves, CPR breathing barriers, face masks, and eye protection can help lower your risk for getting or transmitting an infectious disease when giving care. Latex-free disposable gloves and possibly other PPE are included in first aid and bleeding control kits. It is best to use PPE when giving care if available. However, often PPE isn't available. Remember, your risk for infection is very low, so don't wait until you have PPE to take action. You can give care without PPE, but make sure to wash your hands as soon as possible after giving care, especially after handling blood and other body fluids. Also, avoid contact with your mouth and eyes. If you are exposed to blood, contact your healthcare provider right away. Also, avoid touching other surfaces with your gloved hands because germs can transfer from the gloves to other items or surfaces. This will put the next person who handles the item or touches the surface at risk for infection. After you give first aid care, you should remove gloves using proper technique to avoid contaminating the wearer's own skin, like this. Keep in mind that even when you wear gloves to give first aid care, you should always wash your hands after giving care.